This is the second in the series of videos on acute pancreatitis. In this video, we will discuss the symptoms and diagnosis of acute pancreatitis. So what is pancreatitis? Pancreatitis is inflammation of the pancreas gland that sits behind the stomach. The pancreas produces insulin that stops us being diabetic, but it also produces enzymes that are important in digestion of the food. These are chemicals that are produced within the pancreas and transported through this duct called the pancreas tube. Normally, there would be in inactivated form within the pancreas, but due to triggers or causes of pancreatitis, they become activated within the pancreas itself, and thus causing pancreatitis or inflammation of the pancreas. This has significant effects both within the pancreas itself and further away. These are mediated by chemicals called cytokines. Cytokines are precursors of inflammation and have far-reaching effects throughout the body. I'll come back to this. Now let's just go specifically to the symptoms. To try and understand what symptoms pancreatitis may trigger, let's look at this cartoon drawing over here. And let's now draw roughly where the pancreas sits within the body. So when an attack is triggered, patients typically feel severe pain in this part, right below the breastbone, lower part of the chest, the upper abdomen, and radiating through to the back. And it can go to both sides, and I must reiterate that it is quite a significant pain. So pain is the first feature, and this is often associated with vomiting, and the vomiting usually follows the pain, making the patient feel weak. The patient may find that they are breathing quite rapidly, that the respiratory rate is quite high, and that is because of the effects of the pancreatitis. Pancreatitis is not all or none. It has different shades within it. May be graded as mild with mild symptoms and patients making a quick recovery, or it could be moderate, which sits in between mild and severe, or it could be severe attack that is associated with organ system failure. Here's a cartoon cut out of the pancreas, and once pancreatitis ensues, chemicals are released within the blood called cytokines, as previously discussed, and these have effects throughout the body. They may affect the heart, causing the heart to beat rapidly and for the blood pressure to fall, and hence organ system failure may ensue. They may affect the lungs, causing the oxygen levels to dip and causing the patient to breathe rapidly, albeit sometimes in a shallow manner, and patients may feel dyspneic, i.e. they may be breathless. They may affect the function of the kidneys and causing the kidneys to fail and the urine output to fall. All of these effects are manifested in moderate or severe pancreatitis. In mild pancreatitis, no organ system failure occurs, whereas in moderate pancreatitis, there might be some failure of these organs for a short time, but it reverts within 48 hours, whereas in severe pancreatitis, these effects are for a longer period of time. What can these symptoms be confused with? It's called a differential diagnosis. What can the presentation of acute pancreatitis be confused with? This is called a differential diagnosis. What other conditions may give rise to similar type of symptoms? So here's a cartoon drawing with the gallbladder, bile duct, stomach, and pancreas. So stones within the gallbladder can cause significant pain. Stones escaping from the gallbladder into the bile tube, causing obstruction of bile flow or infection called cholangitis, may have a similar presentation. And also within the stomach is very painful but has a specific history. Perforation within the bowel or the stomach allows escape of contents outside and thus causing significant pain, discomfort, and threatening patient's life. Sometimes the blood flow to the bowel is obstructed, causing the bowel to die and giving rise to significant symptoms. Lastly, inflammation of the liver itself may cause pain on the right side mainly. Once the patient presents with typical symptoms, a set of investigations are required to make a definitive diagnosis. So these would include blood tests, and the most important one are the ones that actually measure the level of the enzymes in blood released due to pancreatitis, the serum amylase and serum lipase. So here's a cartoon, and the pancreas is over here, and when it's inflamed, it releases some of these enzymes which are picked up in blood. Normally the level of these enzymes in blood is quite low. So in terms of blood tests making a diagnosis of acute pancreatitis, the blood levels or serum levels of these enzymes is really crucial. Of course, other blood tests are performed to assess the patient in general, such as the complete blood count, the liver function test, arterial blood gases, urine electrolytes. These blood tests are indicative of the workings of the different systems of the body. The CRP or C-reactive protein measures inflammation and is an important component in assessing pancreatitis. And the most important scan that one could perform to rule out other causes and to be definitive about the diagnosis. Here is a CT appearance of pancreatitis. You can make out the pancreas, which is this gland over here, and this is the fluid around the pancreas during pancreatitis, as well as associated inflammation that you see some distance away from the pancreas. As mentioned previously, a CT is a definitive test for diagnosing pancreatitis, its complications, and ruling out other diagnoses. X-ray, an abdominal plain film, an ultrasound scan, etc. have their place. CT scan has clear superiority in achieving the objectives of assessing the pancreas. This completes the video on the symptoms and diagnosis of acute pancreatitis. If you have any comments, please do share. As suggested previously, for fuller understanding of the condition, please review other videos within the playlist.